What's up, everybody? Welcome back to the channel, Pitt fans. Welcome to the channel. This is quite a surprise and out of nowhere for sure.
Brad Pitt?
No, the Pitt. Different Pitt. I'm assuming Pittsburgh, based off of Pitt.
That would make sense.
Yeah. So just every once in a while, it happens on the channel. Very rare that we'll just randomly decide to pick a show and start reacting to it. I was kind of picking the brains on some of the advisors we have when it comes to like picking movies and picking shows and kind of what's going on. And a few people were raving about this show. So, hey, why not? We're here. I have not watched many medical style shows in my lifetime, but one of my favorite shows of all time is a medical show. And House is one of my favorite shows of all time.
Dude, it's so good.
Gregory House is one of my favorite characters of anything that I've ever watched ever. So
very abrasive.
So this show has a lot to live up to just because of just the lack of medical dramas that we've watched.
True.
So never gone into Grey's Anatomy or any other really big medical show that's out there right now.
No, but I feel like Grey's Anatomy, like, that's like a big deal. So I feel bad that I haven't ever watched that. Sorry.
Yeah, so this is new territory kind of for us. But again, HBO tends to not miss on many things. And seeing some of the hype around this show, I'm looking forward to it. I'm excited to see what this is all about. And also just a quick plug for the channel. We do post full watch-along reactions, completely unedited, but you do need to bring your own copy. It is a watch-along over on the Patreon. Links to that down below. Also, you get that stuff here as a channel member. It just basically mirrors Patreon if you're into the full content and want to support. But yeah, here we go. You ready for episode 1 of The Pitt?
Sure.
Let's go. The Pitt.
It's so pretty.
Oh yeah, okay.
What is
that? Looks like
it's
Pitt.
a Pittsburgh Pirates.
I mean, Pittsburgh Pirates is the baseball team.
Okay, what was that? Was that
football? Was Pitt. It looked like the college team.
Oh.
Because it said Pitt in their colors on the side.
It would be so nice to be able to walk to work.
I mean, you do walk to work. Hour 1. Oh, okay. I was wondering about the title of the episode being 7 a.m. So it's the start of work, the first hour. It looks like the emergency room.
They're always threatening to shut us down, but they never do.
Ano, niniwala ka sa kanya? Hindi ako nagtitiwala sa mga doktor.
You sure you're cool being here today?
Yeah? Why wouldn't I be?
Well, if you need to talk.
Yeah, I won't, but thanks. Where's Abbott?
Getting some air?
Oh, girl.
Hey, you okay in there?
Awesome.
I like to say it goes away, but I had morning sickness for 6 months with my second daughter. You tell anybody yet?
Oh, no. Not until I passed 12 weeks. Not this time.
Oh.
Just so you know, Robby's working today. Today's the day Doc Adamson died. He hasn't worked it in 4 years.
So why is he here?
All I know is he still blames himself for Adamson's death, so if he's a little prickly today, give him a pass, okay?
Great.
Thank you. Hang in there, kid.
I like her. She's sweet.
One thing I did hear about this show is that it focuses on realism. That it tries to be true to, like, being real.
What are you doing here?
I'm working. And you?
Oh, I don't know. Had a guy come in, hit by a drunk driver in a crosswalk.
Awful.
39-year-old vet. Survived 3 tours without a scratch. I spent the last 2 hours coding him.
Damn.
It's always a rough way to end the night.
Must have had a reason at one time to keep coming back, but I can't think of it right now.
Oh my god, dude. Can we not do that?
This is the job that keeps on giving.
Thank you to all of the first responders, emergency medical, doctors, nurses.
Besides, if you
Staff.
jump on my shift, that's just rude, man.
I mean, I couldn't imagine what these doctors and nurses deal with.
See what they even see or hear.
I got a pregnant teen coming back today for a mifepristone, a small bowel obstruction waiting on surgery for the last 3 hours. And unfortunately, the Kraken is still boarding at BH.
Still? Guy's been here for a week waiting on a psych bed.
He's catching some Zyprex disease at the moment, but when he wakes up, God help you all.
Fun.
And you got the med students and new interns starting today, so good luck with that.
Lucky me.
That seems like a lot to deal with, no?
Needles!
Oh,
God.
jeez.
No more needles! Stop!
Sure you want to work today, huh?
Sir, I promise nobody's going to hurt you.
Oh my God. I love how, like, there's only, like, 2 nurses following. And they're like, yeah, you got this.
Dr. Rabinovich? Melissa King. I will be joining you today. I just came from 2 months in the VA.
Hey, welcome to Pitt. This is Dr. Jack Abbott.
Nice to meet you. I can't tell you how excited I am to be here today.
Talk to me at the end of the day.
Shit.
I married my second husband, Everett, in 1964.
Good morning. We're gonna round Dr. Mohan.
Excuse me, Estelle. I'll be right back.
So, you know we track every resident's patient seen per hour.
I was just taking her
It's a
history.
brief backstory about what brought them in, not an autobiography.
I was almost done.
You hadn't even made it to this century.
Sometimes older people just really need to talk to somebody.
The nurse eyeballs them, make sure they're not dying. If not, they're moved to one of 2 triage rooms for vitals and a quick chair exam.
This is so...
Come back to waiting room till bed opens up.
For how long?
8 hours if they're lucky. A lot of times 12.
Is it always this busy?
No.
Oh my God.
It's a lot busier.
A lot busier. Holy shit.
What's going on, Sherry?
Oh.
I burned my hand on a sterno.
What are you doing with the sterno?
Cooking.
You were cooking with the sterno?
We were making s'mores. We've been here for hours. I have to get them to school. Do you know how much longer this will take?
We're gonna patch you up and get you out of here as soon as possible, okay?
What's a sterno?
It's like a flame, you know, like when you like put the crust on creme brulee.
Yeah, okay.
You know, as you do, as one does. I've never used one, but...
As you can see, our house is always packed, and our department is mostly clogged up with boarders. Those are admitted patients waiting for a room upstairs, sometimes for days.
Wow.
Treat the sicker patients back here, but please keep your eye on that waiting room. Make sure nobody's gonna die out there. Your senior residents are Dr. Collins and Dr. Langdon. You report to them, they report to me. Let's do this.
Virgil Straker, 9mm GSW to the left shoulder, CT angiogram negative. Surgery wants to admit for overnight observation.
Good vitals. Good morning, Mr. Straker. You wanna go home?
Hell yeah.
And we all know Louis Cloverfield. Blood alcohol of 420 at 11 p.m.
Wait, what?
How is he still breathing?
That's a lethal dose for you and me. That's happy hour for Louis. It's good to see you, Louis.
It's always a pleasure, Doc.
Oh my
Louis.
God.
Louis just living it up. Dude, you didn't come back
Hi,
on.
old Charlie.
Oh. Where's your tooth, Charlie?
If I can find out.
Cancel the discharge, order a chest x-ray. Gotta rule out aspiration.
Incoming.
Oh, and that can cause a huge infection, right? If you aspirate your tooth.
Drop down the T-tracks. Couldn't tube him, LMA in place.
Rescue. He's a good Samaritan. Took a spill helping a woman who fell off the tracks. She's right behind us.
Okay, trauma 1, go ahead.
Oh,
my God.
Woman fall from T platforms. Good vitals, no head injuries. Degloving injury, right lower leg.
Oh, degloving. Oh, God. Oh, God. Oh, God.
Oh, okay, come.
I know what that means. The skin. The skin, right? Oh, God. I don't know if I can watch this, y'all. I don't know if I can watch this.
Apparently, he jumped down to save the lady. When he climbed back up, he slipped, fell back and hit his head.
Oh, no.
This is like the first 10 minutes of work.
Well, it's the first hour. They said from 7 to 8.
No, but this, what we have seen, is like 10 minutes of work. This is what it's like the whole flippin' day.
The train ran over her foot.
Got caught between the platform and the incoming train.
Over her foot.
Grams,
Do you speak any English? Airway and breathing are perfect.
Shock. Jesus Christ. Oh, my God.
Might have made her faint on the platform.
Could be an arrhythmia, cardiac event. Subway train degloved your foot with an open fracture dislocation.
Ooh, and I thought my heels were painful. Any pain in your chest or belly? Can we please push the morphine?
No, it could cloud her mental status.
I can't do an exam like this. Push the damn morphine. Where's the other guy?
Next door, he's a bit worse.
Hand scanner, let me know when she stops screaming.
Holy shit, dude.
The cords are very interior.
Yeah, that's because we can't flex the neck. Keep the hockey stick straight up.
I'm in.
Good, well done.
5, probably anticoagulated.
With what?
First time here, there's no medical records.
Call for FFP?
No, we got 4-factor PCC.
80 of mannitol to reduce brain swelling, then right up to CT.
I need to close my mouth.
You legitimately need to be a special breed of human being to work in an environment like this.
You have any idea what language that is?
Well, definitely not Tagalog. Maybe Hindi or Urdu.
I'm gonna go get language services.
You speak like 5 languages?
6.
And I thought Collins was smart.
Way too early for you to start being an ass, Langdon.
Open hostility in front of the patient?
She doesn't speak English.
Judgmental and dismissive.
Like, they still keep like a light-hearted mood with each other. And
I
like,
don't know if I could do that.
I think you have to.
Any chance you jumped?
We have been pushed. Yeah.
Oh.
Could be looking at a possible hate crime.
Oh.
Need to talk about your numbers.
People we've saved?
Talking about Press-Ganey scores, patient satisfaction.
If they're still alive, they should be satisfied.
Our goal is 36%. Your department is at 8.
Ooh.
This is an emergency department, not a Taco Bell.
11%.
Well, if you want people to be happier, don't make them wait for 12 hours.
Word.
Most of our patients are boarders who are waiting for a bed upstairs.
Oh, God.
Beds are up there. You just don't want to hire the staff you need to care for.
There's a nursing shortage.
Well, if you paid them a living wage, they'd be lining up to work here. The hospital saves money keeping patients down here in the pit.
I have asked you repeatedly to stop referring to the emergency department as the pit. It is derogatory and incompatible to the institutions in it. I know today is difficult for you.
Every day is difficult down here.
Boarding is a nationwide problem. Your predecessor, Adamson, sure as hell knew that. Or wasn't that something he taught you?
Fuck.
Other hospitals are managing this crisis much more effectively. So you can either step up your game or you can step aside.
Damn, dude. I couldn't
I feel
imagine.
like that's so inefficient.
I mean, she's got to do her job too. And I mean, she's clearly like in the business side of this whole thing. But I couldn't imagine like getting that kind of information and being told you're not doing good enough while you have all of this happening within minutes. I mean, the pacing so far of this episode is just pedal to the, oh my God, pedal to the metal. Like,
The tibia.
oh God.
Nope. Couldn't be me. Couldn't.
Oh my God.
Is that her foot?
Yep.
Or what?
There goes one.
Dr. Robby, she took a fall.
I tripped on the gurney. I'm fine.
Why don't you go get a cool drink in the staff lounge?
I'm fine, really, I swear.
Oh, I know, but it's hospital policy. Anytime someone gets a paper cut around here, we have to fill out a workers' comp report.
I was fine until about 2 weeks ago after the Rochester Marathon.
Any falls or injuries?
Just tired, sore muscles.
Have you seen a doctor yet?
No. I went for a run this morning, had to quit after a minute. Pretty short of breath.
Little pinprick now, okay?
Okay.
Oh.
Didn't take him for a lightweight, huh?
Oh, shit, no pulse. Crash cart, laying flat.
Oh my God. This is horrifying.
Oh my God, these babies. I mean.
Charge.
Clear.
All right, it's back to normal sinus. Need a gurney in here?
Wow.
So what's the plan? ICU, when we can get a bed. Repeat head CT in 3 hours. Nice job.
Do you think he'll wake up?
Maybe. Maybe not.
Okay.
How you doing there, Otis?
Okay. What happened?
Holy shit.
Charged and clear.
This is horrifying.
Back in sinus.
My God.
Oh, groaning's good. 5 of nasal O2 CBC, CMP, troponin, and D-dimer. What are you doing?
1 gram calcium glutamate, IV push.
We don't have the labs back.
Tense exercise caused muscle breakdown, rhabdomyolysis, knocked out his kidneys. Now he's not clearing potassium. I bet it's over 7.5.
You could kill him. Wait.
It's my ass, not yours.
Holy, oh my, I feel like I'm gonna say that a lot.
Have you ever seen a dialysis catheter inserted? Dr. Collins is going to place a femoral quinton under ultrasound guidance. It's an excellent way to learn.
Oh God. Oh God.
My chest.
Yeah, we had to shock you. You're going to be sore for a while.
You shocked my heart?
Long story. Dr. Collins will fill you in.
That art. Oh God damn. They have to stick a. Daniel.
Yeah, got it. Thanks.
I mean, it's not like in it or on it. It's like to the side, and you get it.
Muscle breakdown and myoglobin damaged your kidneys.
Why did you shock my heart?
When your kidneys don't work, potassium builds up and messes with the electrical activity in your heart.
Can it happen again?
We gave you medicine to lower your potassium, and you'll need dialysis to clear it all out.
Then I'll be okay.
Yeah, you really need to hydrate like crazy before and after a triathlon.
I won't let this happen again.
One of the med students took a header. I parked her in the lounge under the guise of a work comp report. Will you just go in there, eyeball, and make sure she's all right?
She's gonna miss the morning arrival of the living dead. We're getting 3, but 1 died en route.
Oh my God.
VFib unresponsive to 3 shocks, 2 rounds of epi.
Oh, they're doing CPR on her right now.
Robotic CPR.
Wow.
You can count on getting a couple elderly patients every day around 7:30 after the nursing homes and assisted living facilities do their morning bed checks.
Lucas off.
Still VFib.
Lucas on. 1 more round of epi, 1 more shock, and then we call it.
That's so sad.
Joseph Spencer, 79, fever and cough from assisted living. He has a history of mild Alzheimer's.
Heart rate 130, BP 90/60. Gave him 500 cc's normal saline.
How are you feeling today?
Is it dinner time? I'm not really hungry.
Call it. Nursing home just faxed us a DNR.
Power out the defibrillator and the
Complete
Lucas.
waste of time and money. Who the hell works at that place?
A nurse taking care of 60 patients who couldn't find the form.
She called 911 so she could take care of the others.
Oh my God.
One of the things we do here is to take a moment of silence when we lose a patient. To respect their humanity and also to remember that this was somebody's child or sibling or parent, friend.
I'm so sorry.
Maybe leave it on vibrate while you're working?
Look, I know I might look too young, but I studied my ass off to get here. Probably harder than the others. I earned this.
Okay, look, I respect your dedication and your determination, but while you're here, you're my responsibility. And when one of my responsibilities takes a header, wow! Abbott called for a surgical consult on the SBO 3 hours ago. You're very lucky they didn't perf.
I'm here to see my daughter.
I'm sorry, is that a patient?
You're talking to her.
Oh.
How's your first day going?
It's great.
Yeah?
Yeah, really great.
Hey, Crash. They're doing a dialysis catheter insertion in North 1 if you want to check it out.
Did she say crash?
No, it's not crash. She said crush, so I was crushing it. Thanks for coming down, Mom, but I've got a patient.
I feel like this is a conflict of interest, no? Like, you know, this kid doesn't want to get any special treatment. She just wants to, like, prove herself. And, like, God damn, Mom's coming.
Triathlete, Otis?
He's stable. Repeat potassium is 6.1. Renal wrote the dialysis order. Tech should be down 15 minutes.
Good, thank you.
How do you keep all this shit straight, man? I can't.
Very smart. Very, very smart.
I feel like I cannot have a single thought that isn't fucking interrupted by other thoughts.
That's why you are not working in an ER. I couldn't do it either.
I have a lethargic 4-year-old. No PMH, no antecedent illness, no fever, vomiting. Parents just couldn't wake him up this morning.
Can you wake up for me, Tyler? He's not usually this sleepy.
No, and he barely flinched for the blood test.
Any chance he could have ingested something?
No, the whole house is childproof.
No signs of infection. We're going to start with blood and urine tests, check for any metabolic abnormalities.
Poor baby.
So what rotation is this for you?
Third, I've done OBGYN and peds.
Are you any favorites?
Not really.
What are you leaning towards?
I'm not really sure yet.
Can I actually ask you a personal question?
I'm 20, and I've earned the right to be here.
Yeah, I don't doubt that for a minute. I was actually wondering if Dr. Eileen Shamsi from surgery is a friend or relative of yours.
She's my mother.
Oh, that's cool.
And for the record, my father also works here. He's an endocrinologist.
Oh, so it's like a family business.
I don't think she wants to be in the
No,
medical industry.
No, I think she does. I think she doesn't want to be in anybody else's shadow.
I think the way she answered the what specialty do you want to go towards, and she couldn't answer it.
Oh, I was getting that. I think she feels like overwhelmed and she doesn't want to state something as fact.
I feel like there's pressure from the parents, especially if they're both in the medical field.
Yeah, and I got chest pains that woke me up in the middle of the night.
Chest pain? Well, it's just chest pain, not chest pains.
And if I have more than one, it's chest pains. Are you even a real doctor?
She's a student doctor.
Yeah, well, keep her the hell away from me.
Hi, I'm Dr. McKay. What's going on?
Oh, I found her on the floor in the bathroom. She can't stop puking.
When did the vomiting begin? Do you have any dizziness or fatigue?
Otis's BP is crashing, 70/50, still waiting for dialysis.
How you doing there, Otis?
Okay, that's okay.
15 liters non-rebreather, please.
Holy shit, dude. What is this? What is he dealing with?
Too much fluid and pressure around the heart. Chambers can't fill.
Otis, you got some fluid around your heart. We need to get it off. Dr. Santos, take the head of the bed and bag him if he stops breathing. Compression until we lose the carotid.
Oh my god.
Thank you.
Oh god.
Injecting lidocaine.
Okay.
Pressure down 60/40.
18 gauge thin wall on a 60 cc syringe, please, Dr. Collins. Let's go. You're going in right over the center of my probe.
Oh
my god.
god.
Oh my god.
Tip.
Oh my god.
Very, very slow.
Oh my
Do not
god.
hit that hard. Dr. Santos, you see that sea of black? That's the effusion. We're looking for a little white dot. There it is.
Aspirating.
3 cc should be enough. Good. Next, we'll place the guide wire and then the triple lumen catheter.
Pulse ox is 99.
Pressure's up, 124/78. That was cool.
Holy shit.
David, have you had any vomiting?
No.
Anyone else sick at home?
It's just us. My husband passed away a few years ago.
I'm so sorry.
Potassium 3.1.
David, have you two traveled out of the country recently?
No, I never go anywhere. She can have to stay here.
If the rest of the tests are good and she responds to treatment, she can go home.
This is weird. Did he give her something?
He just seems very detached from the situation.
I need a fresh set of eyes. 54-year-old woman brought in with intractable vomiting by her 18-year-old son. I'm getting a weird vibe.
How so?
I don't know, maybe she was given something, some sort of elder abuse.
It's just a strange dynamic I can't quite figure out. You're really good at sussing out that sort of thing.
I don't know about that.
Most of the lab results are in and they look great.
He eat anything this morning?
No.
It looks like some sort of gelatin. Any chance he could have gotten into some bath beads or laundry pods? What about gummies?
No, we're very strict about candy.
Danny,
What about Danny?
your brother, he gave me some gummies he got in Cleveland. They were in my coat pocket.
Drugs?
Pot gummies?
Yes, I'm so sorry.
Oh my god.
Yeah,
Walk out, I mean it.
Why don't we step outside and maybe you can help me figure out how much he may have taken?
Holy shit.
The babies, not the babies.
Your son tested positive for cannabis.
It's a fucking nightmare.
This is like child abuse, right? They would call CPS on that shit.
Probably, I would imagine.
Son seems like a nice kid. He's clearly worried about you. But your exam and your labs are not matching any of the usual diagnoses, so I'm not really sure what's going on.
I'm not here for me. I'm here for David.
I don't understand. He said that you've had persistent vomiting, some
I made myself
dehydration.
sick.
Why would you do that?
So David would bring me here. My son has some problems. I found some of his writing. It was lists of girls he wanted to hurt.
Hurt them how?
He said they should all be eliminated.
Oh god.
He's not a bad kid, but I'm afraid he's troubled. He's just a kid.
How old is David?
He just turned 18.
He's not a kid anymore, honey.
Then he's considered an adult, and he would have to consent to treatment. Do you have any guns in the house?
No, he's a good soul. I just don't want to see him hurt anyone or himself.
How you feeling, Crash?
I'd really appreciate it if you didn't call me that.
It's a cool nickname. You earned it. You should own it.
I don't like it.
It's just a joke. If it makes you feel any better, I sharded the first time I saw an emergency C-section.
Really?
Of course not.
I don't know if I'm a fan.
She's
of
a
this
ball
one.
buster.
Okay, but you work to get, like, dude, there's a certain thing as like a certain level of like,
I'm sure there's
hey, maybe
also-
don't fucking say that shit at work, bitch.
I'm sure there's also a level of hazing that goes on for new
I get it.
members of the pit.
How are you doing?
I'm good. I'm always good. I'm an open book.
Not even close. You do know you can always come talk to me,
Yep.
right?
David, I wanted you to meet Kiara. She's a social worker here who helps in situations like this. We heard about your father's passing. We're really sorry. And we know that can put a lot of pressure on somebody your age, which combined with school and now having to take care of your mom.
It's fine. I don't need to talk to anybody.
After a parent dies, the sadness can last a long time.
It's not a problem.
What about school?
What about it?
Anything you enjoy there?
Not really.
A lot of people have thoughts that can disturb them.
What's that have to do with my mom?
I think she's more worried about you.
She always worries about me.
Does she have a reason to?
No, it's almost 8. I gotta go.
See, we're not even to 8 o'clock yet.
Hey, David. David. Hey, just give me 5 minutes. Leave me alone.
Wow.
Hey, David.
Are they required to report that?
Yeah,
in their
they're
position?
mandated reporters. Yeah, but I don't know if that goes just for just kids, adults. I don't know what a mandated reporter, like, I know that's for, like, kids in school and stuff. And, like, as a teacher, if you see something, you have to say something. But, like, I don't know how that works here for adults. Because you technically can't do something until they do something. You know what I mean? You can't prevent, I don't know.
Oh.
Dr. Adamson just went down with a pulse ox of 65.
Oh my god. Oh my god.
What a fucking first episode. Holy shit.
Panic the whole time. This was only 1 hour.
Yeah.
It was 1 hour in an ER in a big city.
1 hour of a singular shift. So this is kind of like 24 in a sense.
Right. Well, I mean, yeah. Not,
Because I did notice the titles, and every episode is essentially an hour of work.
Oh, is it? Interesting.
So it's kind of like, I'm wondering if this, I don't know, I'm guessing, but I'm wondering if like one season is a day of work.
Oh my god.
Which, I mean, one of the things I talked about during the episode, the idea that this is focusing on realism, that I couldn't imagine. And again, like, shout out to all the ER nurses and doctors, because I couldn't imagine. And being the lead, also just the administrative stuff that you have to deal with in terms of keeping a rating a certain level. You've got people that have jobs to make sure that everything is in good standing and that people are leaving the hospital giving it good ratings, while you have a room full of people waiting and you have not enough beds to help the sick people and people are dying. You have what seems to be a healthy person who's constantly falling into cardiac arrest. You have a woman who got her foot ran over by a like, holy shit. The stuff, like the pacing of this episode was non-stop. And also, just add on top of it, you got a bunch of students who are observing.
Yeah.
And one of the students is the child of a very important doctor there.
Surgeon.
Yeah. So it's like no pressure, as if you don't have enough pressure to save people's lives.
That's the thing. That's probably what she's dealing with, is pressure. Pressure to pick a profession, pressure to do well as a med student, like all this pressure. I mean, I was thinking about it. Like, what if she doesn't want to be a doctor?
That's the vibe I got.
She studied her fucking ass off in order to get
and
there.
She's young, so she is clearly ahead of the curve. But I just get the vibe, the way that she answered the question about the focus. I'm like, if you were passionate about this, you wouldn't. And I'm just spitballing, I'm just guessing. I would imagine at this point of where you are in your process, obviously you're still very early in the process. You might have an answer, at least a general idea of a couple options, but
well, she did.
I don't know.
She observed obstetrics, which is
but it didn't sound like she was excited about it.
And pediatrics, I think. She said OBGYN and pediatrics.
I don't know. We've got someone in the family who is going through went through med school and is currently going through the next phase. I forget what it's called.
Residency.
She's
doing so good. We're so proud of you.
There's a passion there to where she knows what she wants, and maybe she's not the example, but that's the example that I have to go off of.
Yeah, pediatric and what is it?
I don't know. Don't ask me
No.
how to say what she wants to do.
Pediatric gastrointestinal.
There you go. Yeah. Don't
Fucking
ask,
killing it.
Don't ask
kid.
me the technical
She's
terms.
doing great.
But I understand the hype around this show. Why, I mean, it is intense. The moment Dr. Robby showed up to work, it was literal pedal to the metal nonstop.
Yeah.
And I mean, he even had to consult with a coworker and save his life because of what he was dealing with in the overnight shift, is what it sounded like. And I mean, Robby obviously is dealing with his own personal, because the mentor, I guess, was that his
during
mentor?
COVID, yeah.
And they gave us like a very quick flashback at the very end of the episode there,
Yeah.
where that looked, I mean,
Well,
horrifying.
my cousin is a physician's assistant, and she worked through COVID, and my God, just the gear, and working in the tents, all kinds of stuff.
I've been to the ER a few times, but again, we don't live in a big, super busy, populated city. But even in those circumstances, the wait times, the crowdedness, and they're in Pittsburgh, which it feels like is obviously I've never been to Pittsburgh, but that ER waiting room, I mean, that's just unimaginable, just sitting there waiting. And it's like, you got the one dude who's like, I've got chest pains and I'm scared and I'm worried and I'm not going to be seen in time.
Yeah.
And the idea that Robby continues to tell, like, oh, hey, make sure you keep your eye on the waiting room. Make sure no one dies out there. Like, holy shit. That was so well done. The pacing, just I love that. And I'm imagining that this is a pretty normal thing if this show is based off of realism. The people who work in the ER, they need to have their moments of like, busting each other's balls, joking around, because you got to keep I would imagine you would drive yourself insane
Well, you have
if
to have
you were
a level,
constantly just...
Yeah. You have to have a level of dark humor.
The stuff that you're seeing constantly literally brought in an old woman who passed away before she even got there. And it's just... the stuff that you see, the stuff that you experience, it's just...
That made me tear up. That was very sad. Like,
yeah.
I mean, but like... the whole idea that there is one nurse taking care of 60 elderly patients called 911 to help this lady because she's dealing with a ton of other patients and like comes back and is like, you have a DNR, which is the do not resuscitate, and they're like, oh fuck, well, we just wasted all this time. Like, that hurt my feelings a little bit, like, but
you have to have that kind of mindset in this environment, I would imagine.
I don't know. I'm too sensitive.
Yeah, 100%. I couldn't handle that either. And I mean,
because I would still be talking to that first lady about who she married and why she married him, and then when he passed and all this stuff, I wouldn't get shit done.
Yeah, I mean, I feel like this show is definitely going to have a lot of difficult moments. I mean, especially considering, just to throw out some personal info, my mom passed away last month, and she had Alzheimer's, and then there was a patient in this episode that had that.
Absolutely
and
crushed me also.
It just, you feel it and seeing, this is going to be a difficult journey.
Well, she's
but,
right here.
I mean, yes,
she's the lady,
she's always going to be with us without question. But yeah, I understand why members of the community were like, I really hope that you guys are watching The Pitt. I get it. The pacing, the performances, just the visuals. There's a lot going on.
Also, is that a job to just go talk to elderly people? Because I feel like I'd be really good at that.
You probably would be good at that.
Oh gosh.
Just sit there and listen while they just
cry
talk.
with you.
Yeah.
I'll cry with you. Let's cry.
Yeah, that was a very powerful first episode. You really feel the chaos and the emotions and just I don't even know the right words to describe the feeling from my seat watching this play out. It's unimaginable being in that position. And then again, having someone from the administrative part of the business coming at you and saying that you're not doing a good enough job. It's just, there's a lot and it's intense. And it was a really good first episode.
It was really good. I'm really glad we watched it.
Do you have any other thoughts?
I don't.
All right, y'all. You guys share all your thoughts. Leave them comments down below. Don't forget, we do post full watch-alongs over on the Patreon and for channel members here as well. So check that stuff out if you're into the full watch-alongs. But yeah, we'll see you guys later for the next one. Have a good one. Bye.